of patients that are smaller but more diversified. Imaging, that's a future sector. Philips in Holland, Siemens in Germany, and the Americans have General Electric. France has lost imaging by selling CDR to General Electric. Nanotechnologies are constantly evolving with, for example, the miniaturization of cardiac simulators and implantable defibrillators. Artificial organs that can be implanted represent another challenge. We need to have high-tech platforms. These will constitute a new adaptable architecture. The emergence of innovation is changing all health procedures, but is it always synonymous with healthcare performance? We need to keep innovation niches stemming from small performing research units, while at the same time developing innovation areas that will develop a real critical mass of researchers and means, just like the CHAM's particle accelerators. Small fish invent and large fish validate and develop. Well, I think we've got our round table. We've got the context. Hello, good afternoon. Hopefully it won't be too difficult. After lunch, after the figures, after all the technocratic information. Now, before we get to the heart of the matter, following the presentation, in other words, the situation of France, how we can get things to change, I suggest that we first of all have some definitions, because innovation is a term that leads to lots of hope, but it also leads to lots of illusions. I hear many people think that innovation is going to help us to reduce our dependence on health. Personally, I don't think that's true. That could be another subject of debate. The more a term is vague, the more you hear about it, in fact. It's a bit like Europe. We think just to talk about it means that we've solved the problem. Innovation is above all about research. It really is based on fundamental research that follows a linear model. For the Oslo Manual that you are perhaps familiar with, otherwise I suggest you read it, it's the New Testament for innovation. Innovation is enhancing, capitalizing on new ideas through products, processes, organizations, and marketing relationships. So, going back to the Old Testament, the prophet of the Old Testament was Schumpeter, who said simply that innovation is all about men, first and foremost, being entrepreneurial and getting away from routine activities. So the first question that we can raise together is, what is innovation? Now, we are lucky today because with us we have some real innovators, world-class innovators. So they know what innovation is because they're involved in it. I'm talking about it, but they actually are involved in it. So, Jean-Michel Dubernard, you're a big specialist of these questions. What is innovation? All right, one remark to begin with. The film was a lot less provocative than the other films. And it said the truth. It was hammering down on our heads. Secondly, innovation for me is very simple. Innovation is about new ideas, and new ideas is all about real innovation, something that's never been done by anybody before. It's something that can be found in medical acts, surgical acts or whatever. We can find it in medical systems, procedures, all of the machines and diagnoses equipment. We can find it in medication as well. But I'm talking about real novelties. Secondly, we're told that there is incremental innovation. Now, what does that mean, incremental? It's quite difficult to understand it. The second point is, well, you've got a great medical device as well. You can have a test tube giving different colors, pink, blue, with different meanings, and that's a real innovation. What are we talking about here? That's my vision. Now, I went to the dictionary, I went to look up the word in the dictionary, and I found that it was all about new ideas. But that's not enough for me. Now, as I'm an intellectual and a scientist, I went to look up some nature magazines. And in volume 8, September 2009, the 8th of September 2009, Nature, I found 2 pages on the definition of innovation. The terrible thing is that there is no definition. That's what's terrible about it. In fact, this work is based on the British government's wish to facilitate and finance innovation with, at the same time, reimbursements. But we don't know how it works. I'm not going to give you it in English, but the question of innovation, it's not something that can be dealt with in black and white terms. But when you talk about enhancing new ideas, capitalizing on new ideas, then people prick up their ears. What are we talking about? Capitalizing on new ideas, economic capitalization, that is. So in there's no real definition of innovation that is really easy. It's a complex notion. It's not about something that's black and white. It involves a combination of many things, which is what Carlo Inserti says, R&D manager for Genzyme Europe. So we don't really know what we're talking about, except we're here for patients, and when you're here for patients, obviously you've got to do something about that. And when you forget the incremental part, you need to have ideas about how to provide guidance and assistance. Now, this is what I've been doing part of my life. I've also been an MP. And quite simply, I'd like to remind you 2 articles. One from the Public Law 51, Article 51, and Social Security Law 9651.1 that shows that if we can apply these texts, we've got to be able to apply them. The texts are voted by the French National Assembly, validated on the 24th of June 2009. Even Mrs. Bachelot said that something about this. But of course, you've got the law, but then you've got to be able to apply it. If we could apply it, we would be able to finance all systems or acts with innovation as an exemption and for a limited time, partial or total management. If it's innovative financing in terms of a fixed price, the product, the service, the act, hospital charges, implementation, after the fixing the rate, the price, the number of patients, the duration of management, the conditions of use, the lists of establishments. If you need to insert cardiac valves via the femur, all wards fight about this. And that's pathetic. So they fixed the number of things, the studies to set up, because studies have to be purely scientific so that we can make decisions based on scientific bases. I'm sorry to be brutal about this. So the question really is very simple. The definition is very difficult. My definition is very primary, very basic. I think we need to accompany innovation in the interests of the patient, not in the interests of doctors, industrialists, etc. So it's in the interest of the patient. To do this, we need to have original measures. And I'm stupefied to see that the British are thinking about something that already exists in our country but is not very well applied. And I think that's what our duty is today. This is the message that we need to pass on. Ministers, make sure that the law is applied so that it's not as bad as it can be seen in some places, and so that we really focus on patients. What do our industrialists think? Well, it's always frightening to speak after Mr. Bernard. I want to say 2 things above all. I want to try and give a definition of innovation, and that's going to be difficult, and then talk about the process that leads to innovation, which will contribute